Hello, everyone. Welcome to our webinar presentation on Beyond Perceptions, Navigating Disability in the Asian American Narrative, presented by Dr. Hoale and hosted by the NASW California Disabilities Council. My name is Helene Diamond. I am the Council Chair for the NASW California Disabilities Council. I'll take just a couple minutes to give the overview of our council. So the NASW California Disabilities Council has a mission statement, and it is our mission to provide an inclusive space for social workers of all abilities to network and collectively address disability-related concerns through education, resources, peer support, and advocacy efforts. The term disability is all-inclusive. It includes those that are visible, invisible, physical, sensory, emotional, and/or neurodiverse. Our council has monthly council meetings. Our next meeting is Thursday, June 20th from 7 p.m. to 8:30 p.m. Pacific Standard Time via Zoom. All are welcome to join. That includes NASW members, that includes non-members, all are welcome. If you want more information or you want to get involved, which I hope that you do, please contact us at NASW-CA Disabilities Council at gmail.com. Our contact is on the screen and also in the chat box. We're also on Facebook. Check us out. You can search NASW California Chapter Disabilities Council. I'm now going to hand it over to one of our council members, Victor J., to introduce our presenter.
Thank you, Helene, and good afternoon as of 5 minutes ago. We are honored today to have as our speaker, Dr. Hoale, a first-generation Asian American who acquired his disability as a young adult and in recent years has become a staunch disability advocate. His presentation is unique in that it offers a detailed account of his life's journey and covers pretty much everything I could say in an introduction. So without further ado, I'll let him share his story. So please join me in extending a warm welcome to Dr. Hoale.
Yeah, no, thank you. Thank you so much, Victor, and thank you all of you. It's been a pleasure getting to know you, and really thank you to the National Association of Social Workers, the California Chapter of Disabilities Council. Thank you for having me. This is awesome. It's quite an honor. So, if I may, some of the learning objectives today, hope that you, by the end of our talk, we can understand some of the intersectionality of disability in the Asian American experience. Learn to identify some of the nuanced mental challenges that our population faces, and also, last but not least, learn strategies to advocate for inclusivity and to foster resilience in our unique population. So this is the beginning of my story, right? This is a picture from a long time ago. I was only 3 months here. I'm the baby there. That's my sister, and this is my mom. We literally just touched down in Loma Linda, California, and how we ended up there. Days before, Loma Linda University Medical Center had come to Vietnam to do a medical mission trip, and there, the night before we left, they basically came to my parents and said, "Hey, hint, hint, we're going to take off tonight in the middle of the night, and if you guys know what we're saying." And so, in the middle of the night, we snuck out, and in order to get on the plane, it wasn't just a free ride for everyone, right? Limited space, and so my mom had to pretend that we were really sick children that needed dire medical care, and that way we snuck onto the plane. This is a refugee center at Loma Linda, California, and this is really typical of the refugee immigrant experience, right? here we are, stranger in a strange land. We don't speak the language. We literally have absolutely nothing but the clothes on our backs, right? What we're wearing. And as you can imagine, there's a lot of prejudice, a lot of discrimination can come with this. And born from that, our parents instilled in us a drive and an ambition to get to a certain place where we can have a voice and be the masters of our own destiny, right? And what more typical Asian way to do that than to quote unquote go study, right? Study some more. And so as a good Asian boy, that's exactly what I did. I went and studied, and so this picture is a picture of me and my medical school mentor. This is Dr. David Wooldridge. He's like 6'5". That's why he's towering over me. Just a really wonderful soul, kind man. And when I think back on medical school, I wish I could say, or anything, I wish I could say that I've always been just this ball of talent, right? I roll out of bed and I'm just full of talent and everything's easy. Yeah, it's not. Uh, I've always had to really work hard, and the word that really sums up medical school for me is just perseverance. And I think that's very important, right, in life. Just perseverance. We persevere to do what's good and what's right. But this was a very special day. This graduation day. Shortly thereafter, actually, funny enough, full circle, I ended up doing my internal medicine residency at sorry about that, everyone. Internal medicine residency at Loma Linda University Medical Center. I came out to California and married the woman of my dreams. My wife, my better half, Jennifer, and so we were on our honeymoon, and 6 days later, unfortunately, I was injured. I was injured in I think the best way to say it is just sort of a freak surfing accident. And that was all she wrote then. I know, looking back, I've had decades to process, and it's funny. People always say, "Oh gosh, wow, you were injured during your honeymoon. That's terrible." Yeah, it is. But funny enough, whether it happened before, during, or after, uh, it really doesn't matter, right? In retrospect, any time for this to happen is not ideal. But that's life, right? We have moments of elation juxtaposed with moments of deep sadness, and it's okay. We have to find a way to keep going on. And I want to pause the story right here, right? I want to pause the story at the injury, because really, there's everything before the injury and there's everything after the injury. And let's talk about what it means to have a disability, right? What our disabled experience is, and really, it's just a spectrum of the human experience. But I'd like to get into a lot of the uphill challenges that our population faces. And so let me start with this. I think defining ableism is incredibly important in the entire narrative of disability. Ableism seems to be pervasive in everything that we contend with, and I think it's really at the heart of the paradigm that we have to shift if we are going to make any real change going forward. So, what is ableism? Well, as you can see here, ableism is discrimination against people who are disabled. It includes discrimination against people with physical, mental, or mental disabilities, any sort of disability. As we just heard Helene mention that disability is all inclusive here. To take this definition further, I really like seeing ableism as putting non-disability as at the very top, as the gold standard for everything, and anything that's different from non-disabled is considered quote unquote less, right? So that's at the heart of ableism. We have some good examples here for ableism. Denying someone a job because they're disabled, making jokes about a person's physical or mental disability, designing inaccessible office spaces or in any inaccessible space, right? Or schools that don't provide differentiated resources. Interestingly enough, there's positive and negative ableism. The tougher one to define here is actually positive ableism. Positive ableism is when someone thinks that we in the disabled community we need saving or rescuing. Oh, hey, oh, poor thing. Can I carry you across the threshold? This one's difficult to define because it comes from a place of understandably at times kindness, but it's still harmful, right? It's still harmful. Negative ableism is a lot more straightforward, right? It's just outright hostility or we say desire to deny disabled people opportunities that would otherwise be open to them. So that's negative ableism. I hope that's a good intro to the definition of ableism, and again what we fight against. Now, in our real life day-to-day living, how do we combat ableism? Well, I like this first one on the left upper corner. Respect people with disabilities and their decisions. And really that part about their decisions is we can even see it come to light even during COVID times, right? When our disabled community was being literally treated as less and asked to sign waivers in the ER and such, to waive going to the ICU should you need to be intubated, being treated as such just because of a disability. That's blatant ableism, and it's just it's terrible. It's a disgusting thing that we have to fight against. Other things, double check our words and actions. Think before we speak, right? Being a good ally or looking out for each other. Call out ableism when you see it. Fight for inclusivity. We hold our organizations and politicians accountable, or we can even say hold our leadership accountable, right? Anywhere. And promote accessibility when we can, right? That's a basic root need. Now, with all that in mind, I think it's important to talk about some of the main models of disability, just to understand the lay of the land as it pertains to disability. There's the charitable model, the medical model, the social model, and the identity model. And I like to describe it actually in that sequence as well. Because charitable really goes back even hundreds and hundreds of years, right? If we look at historical works, whether it's historical art or historical literature, you'll see blatant examples of the charitable model, and the charitable model again being the model where we in the disabled community are to be pitied, seen as weak, seen as needing, just as the word suggests, needing charity, needing charity in order to, we're seen as the disabled community is seen as a burden and something to be again pitied and charity. So that's a very archaic model, but hey, many of these still exist, right? The medical model, unfortunately, is still very alive and well. The medical model is more so a model rooted in oh, there's something wrong with we in the disabled community. There's something wrong with us, and we need to be quote unquote fixed. And one of the unfortunate realities of the medical model is that quote unquote experts. And when I say experts, yes, many of my fellow physicians, just in general in the community, right, fellow physicians fall into this trap. Here we are. We make decisions uh, uh, about our patients who have a disability, but yet we don't really, when I say quote unquote experts, we don't really uh, keep the actual patient in mind. If it's a decision that's made for us, it should be by us, and rather than made by, again, a so-called expert who has no idea, no knowledge of uh, of what our how we live and what our needs are. And so again, that's our medical model, unfortunately. Now we move to a bit more healthy models to strive for. We have the social model that's really perhaps a big part of where we are now. It started a long time ago uh, with activism back in the day, and it culminated. I hate saying that it culminated in with the Americans with Disabilities Act in 1990. We'll talk about that in a little in a little bit, but we say culminated in that, and unfortunately, it just sort of stayed there. But the social model is more rooted in activism, right? Social inclusion and social activism, and again, that's a very healthy model. Now, perhaps even healthier and something that we're striving to in this beautiful day and age. I know it's 2024, is the identity model. The identity model is the model where we fully embrace, we accept who we are, right? And it's part of our identity. It's don't just call me um, don't just call me someone on the spectrum. Call me. This is just an example. Say, yeah, I do have autism, or I do have this and that. Don't just label someone as a general label as neurodiverse or something like that. That's an example. Uh, it's rather, hey, this is me, and I own this, and it's part of me. So let's shift gears just a little bit and talk about mental health in disability. As you can see here, this is a beautiful CDC infographic stating that adults with disabilities report frequent mental distress almost 5 times as often as adults without disabilities. Here it says, screen patients for mental health concerns. Obviously, screen everyone, right? But the point here is that our disabled community is even at higher risk for having some sort of mental health issue, mental health illness, or mental health distress. This is very understandable. And so in this infographic that I made, you can see it's quite cyclical, and all of these things feed into mental distress in our disabled population. Here we start out with the passage of the Americans with Disabilities Act in 1990. Unfortunately, the reality with the ADA is that really, in here it is. It's nearly 34 years old, and it's at times incredibly woefully inadequate. Right? It's woefully inadequate. It seems like it's just people were just sitting on their laurels in this came out in 1990, great, and then it never went anywhere. It could be so much more, right? But with that said, that's exactly what the point that we're trying to make here. Despite the passage of the ADA in 1990, our population still faces discrimination, and we still, the truth of the matter is, we still have unequal access to employment, housing, medical care, and insurance coverage. Now, superimpose on that some of these other issues that our population faces: physical challenges, not just immobility, right? That's kind of an obvious one at times, but extreme pain. And a lot of these are chronic. And when it's chronic, that only feeds into more mental distress and a higher likelihood of having, again, mental distress and mental health issue. Then we have social challenges, of course. Our population is at much higher risk of having isolation and loneliness. Of course, being excluded from activities that normally would be extended to those without a disability. Our population also is at higher risk for having abuse from caregivers or partners. I've actually, I have a colleague at work that is blind, and heard from her that she's known a lot of people who've had partners who are abusive, unfortunately, and lack of access to proper care. So a lot of these challenges feed into mental health issues in our disabled population. Now, along with that, barriers to mental health care. What are some of the barriers? Well, some of the low-hanging fruit would be communication. Obviously we have hearing, speaking, understanding, lack of reliable transportation. We talked about the ableism. We defined what ableism is, the dehumanizing stigma. And here again, the reinforcement of the medical model that we are somehow defective and we need to be fixed. And even sometimes this discriminatory perception that we are not proactive about seeking care. Unfortunately, I think that's far from the truth, but some perception that we don't, just because we have a disability, we don't like to take care of ourselves. Now there's a lack of integrated care. This is true. This is true with many medical models, hospital models or medical systems that we see. Lack of integrated care. So, oftentimes it's not just physical needs. Again, lack of treating the whole person care. Traumatic stress. Interestingly, we forget that a lot of the interventions and treatments that we prescribe can be painful, can be traumatic, right? And again, we talk about isolation that feeds into depression and anxiety. Mental health issues are often overlooked while focusing on physical needs. We worry about some of the underserved areas. We say rural or even inner city would be our couple of easy examples of underserved areas. And we know we all work in the system, right? Everyone, we know that it's an overburdened system. Unfortunately, that's just the way it is. And I know we have to find a better way. That's an entirely different talk, right? And poor collaboration and communication within these systems. We do have issues with fragmented care, unfortunately, right? Again, nothing we're going to fix here today, but part of a good ongoing discussion as we evolve in our careers in the healthcare field here. And then of course we have poverty and unemployment. Our disabled population is at quite high risk for that. And then cost. So it really underscores the need to find the right team. Finding the right team. Be a self-advocate or advocate for a loved one. Keep your own records. Do research and be as informed as possible. And then we have here, obviously I'm not going to go through all of them. Many of you have access to this to either see or hear this. Ask questions during visits, right? What do you think is contributing to my mental health issues? Do you have any providers who specialize in treating someone like ourselves in the disabled community? Anyone who can help coordinate care? How would I go about asking for accommodation? I like this slide to take a break to give a shout out to all of our social workers out there. I want you all to know that how important you are in the interdisciplinary team meetings, right? Going forward in your careers, or maybe you're already deep in your career. I love my social workers, and you all are so important in taking good care of the patient. When I say that, the best ones I feel during our interdisciplinary team meetings are the ones that are able to help contribute to how best we can communicate with the patient and the family. So cultivate these these uh, these relationships that you have with the patient and the family. Please inform us on family dynamics, on how best to get through to the patient, especially when we have to have these difficult conversations. And quite honestly, guys, there's so many times where I feel our patients like you all a lot better than they like us, understandably. But yeah, you guys deserve it. You guys are great, and again, such a pivotal part of the team. Uh, so so I don't know if I don't know if many of you have seen Disney's Encanto, um, and this awesome song from there, one of the big production numbers, and the main character. So we don't talk about Bruno. So for some of you who haven't seen this, Bruno was one of the main characters, right? And unfortunately, he was he was perceived as having some mental illness, and uh, rather than being supported, he was forced to literally live within the walls and hide out, and really just watch his family from afar. And the reason why I have this up here is because I feel that oftentimes this can typify the experience of being Asian and having a disability, right? So I feel this typifies the experience of being Asian and having a disability. We don't talk about Bruno, unfortunately, and so let's talk about that. So disability in our Asian culture. Well,
One moment for an interpreter switch.
sure. Thank you.
We're ready if somebody can pin me, please.
Thank you, everyone. So, per the U.S. Census Bureau, nearly 1.3 million Asian Americans identify as having a disability. Put in a different way, per the CDC, 1 in 10 Asian Americans have a disability. It's quite a bit, and unfortunately, compared to our fellow humans, our fellow other ethnicities, our African Americans, European Americans, and Latinos, Asian Americans report highest rates of stigma toward physical and mental disabilities. That's a pretty heartbreaking statistic, but unfortunately, that sums up a lot of the Asian culture and disability, right? A lot of things feed into that. There's in our Asian culture, as many of you will attest to, right? There's this concept of saving and losing face, and unfortunately, this all this does is breeds shame. Shameful to identify as disabled. Shame and like Bruno, taught to hide our differences, hide away. There's this interesting. I know we talked about the four major models of disability just now, but in our Asian culture, there's also this nuanced moral model, a moral model of disability, and it involves a lot of it involves a lot of deep rooted things, such as some cultures, some cultures feel that disability is a result of bad karma, family's wrongdoing in the past, perhaps. Uh, Again, taught to be private about the disability. Just hush hush about it. Don't talk about it. Don't let's not even say the word, right? And unfortunately, downstream from that, what happens? Well, people avoid seeking diagnoses. You have to you have to say it out loud, and you have to accept it first, right? Before you even seek help. And unfortunately, this is one of the hindrances in the Asian culture with disability. And here, unfortunately, we say hide the child away. It's a shame. You're hiding a beautiful child away just because of this. And again, one of the harmful things downstream from all of this, many families refuse medical, social, and support services. So really, really, really unfortunate. This is at the root of Asian culture and the intersectionality of disability, right? It's heavy on the charitable and medical model. I know now we're reinforcing that yet again, right? We say charitable model, those in the disabled community are to be pitied or seen as weak. Parents and families can be overprotective. Again, we talk about the positive ableism. This comes from a place of love and caring, but it's harmful. It can be harmful, and then even the assumption that your partner needs to be your caregiver as well. So even in going out and finding love, finding partnership, unfortunately, oftentimes families can think in a way and say, oh gosh, your partner needs to be your caregiver too. Of course, invisible disabilities are met with skepticism, right? If you can't see it, touch it, or feel it, it must not be real. So that's an unfortunate aspect of this as well. And again, we are something to be fixed. There's something quote unquote wrong with us rather than just us be ourselves. And of course, there are in the intersectionality of our Asian culture with disability, there are cultural barriers that again, low-hanging fruit, lack of translators at times, lack of cultural sensitivity. The cultural sensitivity is an important one, and I think in what we do, we continually have to ensure that we keep our education, or rather training regarding cultural sensitivity fresh. This is something that to me consistently has to be, we have to work on, right? A lot of the handouts are complex, way too complex, and not in the appropriate language either. And interestingly, again, it's not just ableism that we contend with; it's racism too. It's both, superimposed on that. That's a lot to really work against at times. And needless to say, there's a lack of community because the stigma is suppressed. A lot in the community, our community avoid associating with other disabled folks, and we silence and hide the disability. Again, hide away. And this last one really breaks my heart as well. Internalized shame. Again, it prevents development of a positive disability identity, because that's why we're all here, right? We're striving to accept ourselves, and instead, this lack of community and the culture around this can really hinder that. So what do we do? We rise and we fight. This is a phoenix rising, and this is, I like to look at this as something that our disabled community, just in general, has to be like, has to strive to be like. We fight and we rise, right? It doesn't matter what anyone else has to say or what society has to say. We bring it, right? It doesn't matter. We bring it. And so this is just an article that they happened to write about me when I came back. Let's start the story again, right? Let's pick up the story again. When I was injured, I was away for about 15 months, just trying to, and forgive me for not being precise before. My injury ended up I have T12 paraplegia, and so I use a manual wheelchair to get around and such, right? And as you can see here, I was away for about 15 months, but just like all of you, I love taking care of people, and and I love medicine. I love medicine. It's I'm just not good at anything else, and so I came back, and there's a lot to fight against. I felt like I had to reaccomplish everything that I had already um, worked for. But again, we persevere. I ended up getting into a hematology oncology fellowship at University of California, Irvine, down there in SoCal with many of you. And I think a big point of this is just we again we have to be brave, and I love the idea that we go out in the world, and this is for all of us. Go out in the world and let the world see us. Let the world see all of who we are, all that we're capable of, and to see that our disability is not a disadvantage in any way at all. It is not a disadvantage, and in fact, that we are a creative and generative force. That we are a force, just an amazing force. Whether it be, and we have so much to contribute. Whether it be profound strength, perspective, or just unparalleled problem solving, right? And again, uh, many of you out there know that we have to problem solve 24/7, 365, right? Every day of our lives, and so we have a lot to contribute, and I think doing so, getting out in the world and showing everyone what we're all about is part of shifting this paradigm that I was talking about, the pervasive ableism that underlies that belies everything. So yeah, I love that idea, and I want us all to go out there and show the world what beauty we have. Uh, it took a while for me to feel this way, right? And actually, in a couple of days, it will be my 21st anniversary of the injury. Yeah, in a couple of days, actually, exactly. And uh, it we're all at a different part in our journey with our disability. We're all somewhere different, and it takes some time. Sometimes I feel perhaps some people have been injured for 50 years, and they may not still be as comfortable in their skin. But we're all somewhere different. But the point being, once we are comfortable enough, the beautiful thing about that is that can, we can then focus on others, focus on helping our sisters and brothers in the disabled community, in the community in general, right? And so, Reach Career Mentoring is something that my wife and I started some years ago. We started it because, as I alluded to just now, when I was away for 15 months when I was injured, then came back to my residency. It struck me. It struck me. It was so difficult. It's one of the most difficult things I'd ever done in my life. But it struck me that I at least had one foot in the door already. Well, what do others do when they don't have that opportunity? How about youngsters with disabilities? Who models this for them? They're going to reach an age and start to hear no, impossible, you can't, things like that. And that's just not okay. That's not acceptable. And it's also just not true. It's just entirely untrue, right? It's an erroneous notion, and it's wrong. So we started this to help mentor anyone. Youngsters are not. Over time, it evolved to be an older age range, but mentor anyone looking for career advice with a disability. Yeah, and you can see some of the statistics here. The reason why we did it, the higher rate of unemployment in our disabled population, and despite very talented and intelligent people, we're as, if not more, capable and intelligent than our non-disabled colleagues, but not given a fair shake. So really, really proud to start this. And here we see one of our own here, Cindy Chen. She's one of our mentors. If you know her, she's such a good soul, such a lights up a room, really intelligent. And my point really with this is not to embarrass Cindy, right? But to say, hey, she's a wonderful example of embrace who we are, connect with our people, and help each other have these conversations, right, regarding disability, whether it's family or in the community, and help advocate for one another. So again, shout out to Cindy Chen for being such an awesome example of this. But this is really what we should all strive for. If we just cloned Cindy, I think our community would exponentially be that stronger, right? More powerful. I want to say, so locally, other ways to advocate, right? So as my story is coming to an end here, I happen to be an oncologist at Kaiser Santa Clara, and I'm ashamed to say that for the longest time, we didn't have any representation for our own disabled peeps, right? Our own disabled folks. And so one of the guys you see here, Han Lee, he's a cardiovascular surgeon. His daughter happens to have a muscular dystrophy, a progressive muscular dystrophy. And so he stopped me in the hallway one day, just said hi, and we became friends. And he instilled in me this need to represent our disabled population locally. And unfortunately, it's not just our medical center. There are a lot of medical centers that don't have this kind of representation, but I knew that at least locally we could start something. So we co-founded this Santa Clara Kaiser Medical Center Disability Alliance team. You can see our mission here, creating a voice for those living with disabilities, and through inclusion, advocacy, and empowerment of the disabled community, we hope that Kaiser can be the ideal place to give and receive care. This was grassroots, right? This was grassroots. It started out with 2 or 3 of us in a room talking about it, and I had to be appropriately and professionally annoying, right? So I chipping away at that until people listened. But my point being is that what I learned from this process was, one, we have to have a united front. If we're going to make any change, affect any change, we have to be united about it and support each other. We have to have a united front. But the other thing that I learned from this is that, it's okay to not be so nice about it sometimes. I mean that. It's okay to not be nice about it. Again, oftentimes people didn't wish to listen until I was clear with my disdain for the situation, and being stern about it, right? And I want to say the administration, fortunately, where we are, has been very receptive. But this is all part of fighting for what we need, and for our voice, and just being heard, right? Unfortunately, I feel like in all of there's a lot of good EID work lately, but even in EID work, our disability seems to take a backseat at times, and we can't be okay with that. We cannot be cool with that at all. We should not be. We should be angry about it. So yeah, that's a big part of my lesson. Just some other wonderful examples of people in our community. This is Alice Wong, as many of you may know. She's up here in the Bay Area, the NorCal region here, NorCal area. She is the founder and director of Disability Visibility Project. She's an activist, a community organizer. She has a massive presence on X, right, the formerly known as Twitter, X, and Instagram, and she wishes to amplify our experience as being disabled, but she also happens to be Asian American in the media and culture, and so a lot of ways that we can strike out and fight for our own, right? I love this slide just because it illustrates the different ways that we can find our voice, that we can be advocates, we can be activists. We see Gandhi did it in a very peaceful and a passive manner, but still incredibly effective. Here we are talking about him. We still have the very current Malala Yousafzai, who goes about it via education, right? Education. She's very incredibly well spoken and feels that education is the key. And then on the bottom here, you see the great Martin Luther King, who went about it in a slightly different manner, a bit more vociferous. Again, a different way of going about it. But again, find your own voice. There's no right or wrong answer. Just go out and fight for our population. I think that's I know I use that word a lot, but I see it as an important fight. And really, when I say fight, it's just to spur us all on. It's don't be too content and sit back. It's as Gandhi said, we are, be the change in the world that we wish to see, right? So it's up to us. It's up to us and all the beautiful, strong souls here. We want to see you out there and showing the world again what we're all about. And so with that said, thank you everyone, and happy AAPI Heritage Month. Thank you again to the National Association of Social Workers California Chapter Disabilities Council for having me, all of you. This has been an honor, and I love sharing my story with you, and I'm forever your partner and advocate in this. So thank you so much.
Wow, thank you so much, Hua. That was beautiful. Thank you.
Thank you. Thank you. Thank you.
And we wanted to kind of open up to ask some questions. The first one we have, if others want to start a disability alliance type team at their agency or place of work, do you have any advice for them on how to start it?
Yeah, well, yeah, no, that's such a good question, and a difficult one at times. I say at least start the conversation, because I feel like when we started this, part of it was, it's not that people are terrible people and they don't want to advocate. It's just that they don't know too. They're let's call it what it is. They can be very ignorant about it, and it's just, again, not blaming them. They don't know what they don't know, and that's what we do. We're opening their eyes. We're having that conversation with them and saying, hey, did you know this is an issue and this exists? And no one, however you wish to go about it, hey, no one seems to care about this right now. There's no voice for our population. I think that's a good start. But I also, something that I've learned along the way is to use some data too. Data's tough just because, locally there might not be tons of data that you can find, or it takes a while to get data, but there's data in the literature, whether it be PubMed or something like that, to say, okay, when workplaces include more of our disabled folks, our disabled population, us, it equates to increased productivity. That exists, and I can't remember where I saw that. Forgive me off the top of my head, but there's data like that exists, and I think it's important to back that up with some data. And again, we're educating. go into it with the lens as I'm educating my, some peers or the administration, people who don't get it. So I think that's a good start. But great question.
Thank you. And then
You
the
have,
next one we have is how can we support communities that live with disabilities without reinforcing positive ableism?
oh gosh. Ooh, wow, that's a good one. And team, by the way, team, please, please chime in if you have something to say about these two. That's a good one. That's such a good one. I think so. When we talk about, I was talking about show it, so positive ableism. It's sort of like when you roll out in the streets and someone says, "Oh my God, oh my, you're my hero for the day," and this sort of thing. Oh my, just for being out, and you look around, and you're like, what did I do? Why am I a hero? And that's kind of this positive ableism where, oh my, oh, if I was you, I would just be, locked away in the closet here and just not even show my face and look at you. So you're right. You're right. That's a difficult one. I, I feel like when I'm just doing my thing and someone asks me, hey, do you need something? No, if I don't, I say, thank you for asking, but I got this. And they see us out and about. They see our community doing our thing, just living our lives. That's perhaps a beautiful start to the conversation, because then uh then we're seen. We're normalizing our experience. We're normalizing who we are. Again, rather than getting a trophy for every time I roll out into the sunlight, that's, yeah. Uh, but that's such a good, deep question. I I wonder if, it's these sorts of events, these sorts of events where we can get visibility and highlight who the heck we are, and the gifts that we do have. Uh, that helps too, right? And yeah, otherwise I'm not sure. But just, yeah, this is part of the fight, right? Great question.
Thank you, Hua. And maybe we cannot even ask, Helene or Victor. But as for me, I really like that you pointed out to ask first. I think a lot of times, I work with a coworker. I know she wants to help, but
Right.
it's so overbearing. It's no, 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 I got this. No, no, I got this. No, let me do it. I can do it, right? No, 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 you don't
Yeah.
have to do it. Let me do it for you. So I think it is important to respect what we want, but also I think for me too is why are you offering the help? Is it because you feel bad for me? You feel pity for me? Or is it because you really see that this is something that, I can benefit from, right? After asking me. But
Sure.
I think like kind of like what you point out, asking for permission is very important. Thank you.
Yeah. No, thank you, Cindy. Yeah. Nicely stated.
Thank you. Thank you. Helene, Victor, would you like to add in anything?
Sure.
That's just that. I'm sorry, Victor. Can you go first if you want?
No, 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 no. You first, Madam Chair.
We can fight over it. I'm just kidding. I think I'll just add, just like you've both been saying, offering to help without assuming that help is needed, and being open to accommodating, to make, including people with all abilities to all different events. They can participate in all different things, and be open to modifying things or adding things that's more inclusive so all can be involved. So an openness without making assumptions.
Thank you, Helene. That's awesome.
And this is Victor, just to kind of tag on to everything that was just very beautifully said. I can't emphasize enough, the importance of cultural humility when it comes to, being an empowering force for, folks with disabilities, because, that, involves a lot of introspection and co-learning, and it's an ongoing process. And introspection can really, mean looking at, for example, your own lens from which you view disability. There's a lot of people, a lot of us here that are trained in the medical model. And it might be, helpful to kind of check. It's like, okay, am I viewing this right now as someone trained in the medical model, or am I seeing it more in the social model, where this person's needs, really lie within a disconnect between their traits and their, environment, and how can I be an ally in bridging that gap, according to what that person finds helpful, as opposed to like what others said, making assumptions.
That's awesome. Thank you, Victor.
Thank you, thank you. And then we have Christine with her hand up. If you would like to ask a question.
Okay, thank you. Great discussion, Poe. Very well done. Curious. One thing I'd like to add that I'd like to pose a question is that the first thing that I would like to add is something that I often do. I use a wheelchair, power chair most of the time, and a lot of folks who don't understand will refer to a lot of us as wheelchair bound. Please get away from doing that. Please, please, please. We are wheelchair users. And I will often rephrase somebody's comment. Oh, you're confined to a chair. No, yes, I use a chair. So they, I model what it is that we're after in order to raise awareness. And the thing that I was curious about, and I don't know if you'll have the answer, Poe, but I was really curious to know if folks have noticed a change or an increase in I don't know what it's referred to from the other culture, but I know in Japanese you're looking at Nisei, Issei, Sensei, generations. Are you finding that as generations go further forward, that they're having an easier time, so to speak, to maybe not accept, but certainly work within acquiring a disability or having a disability? You were mentioning in the early part of your discussion how, and it's very true across the board, looking at all of the strata of people with disabilities, the the practice of hiding and shaming. Are you noticing a change in how that's approached?
Yeah, that's a good question, Christine. Boy, I don't have any actual, I don't have any, let's say, updated data for that. I feel like in general, as disability has become more visible, whether it be again, like this, having the conversation, understanding that more people actually have a disability than not. I think even in this era where we're gathering data, I think it's becoming clear that now we have long COVID, we have a lot of things that are going to contribute, to a larger percentage of the population being considered disabled, perhaps actually even younger. Not this, what is this? More than half of folks in U.S. by the time they're 75 plus will identify as having a disability. Well, I think that number is going to shift to be younger for one, but I think as we understand, we talk about the invisible disabilities. We talk about the large spectrum of neurodiversity and things like that. I think more and more folks will identify as such, and as we have these conversations, I wonder if it's better, even with the Asian, in the Asian community, especially we say Asian American. Yeah, I think Asian American will be easier. I'm not, I can't speak to in other countries. I don't know if it's still, unfortunately, quite traditional as the things we pointed out during the talk, but I'm hoping that at least Asian American is different, as we as we feel more comfortable expressing ourselves in this way.
And that's also an interesting thing to look at, whether it's American versus other countries. Yeah.
Exactly.
I'm sorry, I need to go, but thank you so
All right,
much.
Thank you,
thank you
Christine.
so much, everyone. Thank you, Hoa. That was
Yes.
an amazing presentation.
No, thank you again for having me. Yeah, everyone.
Thank
Yeah,
you
take
so
care.
much.
Yeah.
Thank you. And please, this is the link for the survey, and then follow us on Facebook and send us emails. Maybe you could shoot it to Hua and then you can answer more.
Great.
Thank you so much again.
Wonderful.
Take care, everyone.
Yeah. Stay safe, everyone.
Thank you.
Bye.
Thanks very much.
Bye.